Very welcome to this webinar tonight. We have a lot of really cool panelists, and I'm very, very honored to have a super cool team of vets and farrier and physio on my side here. And we'll be discussing how you can use objective gait analysis in your practice in general, but also in communication. So if you guys are ready, then I'll actually get started to just give a small introduction to this topic and see if we can get us going. And then I think we have Marc Jerram, who's a farrier, who will continue straight after me. So the topic of today is to go from data to action and, of course, using objective gait analysis in equine health management. And my name is Elin Hernlund. I am a veterinarian. I'm a PhD in equine biomechanics. I work with sports medicine and rehabilitation in horses. And I'm also one of the founders of this company called Sleip. Just to get us a little bit started, because we are from different type of work here a little bit. We all work with horses and we care for horses. I guess that's why we're all here. But just to say that sometimes what we measure using the Sleip device or the Sleip application can sometimes be a little bit confusing. And there will be a lot of questions of who uses it in what way. So just to get us started with the definition of lameness, because actually we do not measure lameness, we do measure asymmetries using Sleip. So if we look at the definition of lameness, I've asked two really experienced clinicians and researchers in the field. So Dr. Sue Dyson, she would say that lameness is an abnormal gait caused by pain. So that's a little bit simplistic, but fair. And then Dr. Florian Buchner, who is one of the guys who wrote the very foundational biomechanics papers on lameness and has written a lot of the sort of lameness books as well. And he says that lameness is a gait alteration due to a functional or structural disorder in the locomotor system. So you can see that both of these definitions, they would actually say that lameness is a health issue, a health problem, and that gait is the telltale of that. And then if we go to some of the more recent debate about lameness that has been published, you can see that Van Veren, René, who's a very senior biomechanics researcher, and Andy Bay, they would say that lameness is a continuum rather than a binary concept. And this becomes really interesting because if lameness is not a 0 to 1, but it's a continuum and it is a gait deficit and it tells you something about a pathology or that there is a problem, then how does Sleip come into this? So lameness instead, I'd say, is a clinical sign. So it's not a diagnosis, but it's something that indicates musculoskeletal disease. A diagnosis would be much more specific. But this clinical sign called lameness is composed of several clinical indicators or different small movement elements and also behaviors. So as a vet, for example, you would observe different types of elements of the motion of a horse or its behaviors that would tell you that it has sign of disease. And these movement elements, they can be measured objectively using different types of technology. But if the horse is lame or not is up to the vet's clinical judgment. So just to try to frame that into something. So lameness is a clinical sign. It's something that the vet would decide if the horse has, but it has small components of it, sort of elements that we can measure objectively. And these motion components that you can measure, and these have been studied really well in biomechanics. The components that are most important, I dare to say, are vertical motion asymmetries. And this is built on a very big body of scientific literature. So vertical motion asymmetries of the axial body segments, and most of the time then we talk about the head and the pelvis, but we could also talk about the trunk, is then the most essential element of lameness, I would dare to say. These measurements, if you measure these vertical motion asymmetries, so thinking about it as going sort of up and down for each stride, has a very high sensitivity for lameness or musculoskeletal disease. So it's an indicator that's very sensitive. And since more than a decade, this motion can be measured using different types of objective methods. Okay, so what does Sleip do here? So I've been using a lot of different objective gait analysis tools. And what is specific with Sleip? Well, actually, not very much, not very different from other types of systems that you can use to measure asymmetry, but it's very easy to use it. So it's easy to make the recordings. It has still an advanced sort of biomechanical output, and hopefully it's going to be in a friendly format. So in a horse like this, we would measure the vertical motion asymmetry of the head, which are these curves, sort of double waved form curves, indicating how much load there is put on the left and the right fore, and then the same thing for the pelvis, which is indicated in these curves. The curves are compared stride by stride, and you get these asymmetry parameters out of them. And these parameters would then tell you biomechanically if you have an alteration from a limb that would generate an asymmetry and in which part of the stride that happens. So for me, it's very, very useful, but it's important to know that it's not lameness we're measuring. It's an element and an objective indicator of lameness. So you can use Sleip for different things. You can use it to measure with precision, you can use it to monitor, you can use it to detect disease, and you can use it to refer. And I think this is going to be like the theme of what we're going to discuss today, and see how different people within the equine health industry would use it, and how you maybe not use it as well. So for a vet, this would be something you'd use for precision diagnostics. The vet application, so there's a version of Sleip that's for vet, and this was the original thing that we developed, of course. It has features that are unique to the veterinary setting, and again, it's very sensitive for lameness as a parameter, and it would identify the limb and the stride phase alterations. But other professionals within the equine industry could also use these measurement tools, and this is what we're going to discuss today. So motion asymmetries of this kind are often go unnoticed. So a lot of the studies that I have performed at my university, but also others around the world, show that there is a lot of motion asymmetry out there. There's potentially also a lot of lameness out there that goes unnoticed. So if a horse has a high level of asymmetry or an increasing asymmetry in response to training, that's a horse that we want to sort of pick out of the crowd. We want it to get medical attention. And using this, so that means a professional trainer could be using Sleip in a gait monitoring version. A physio could be using Sleip, or a farrier could be using Sleip. And you guys notice some of these. This is Max Kühner, who is one of our professional trainers that use Sleip regularly, and then you hear more from Gillian and from Mark. So this type of measurements, of course, can then detect, and it could make you sort of a better referral partner to a veterinarian. And this could be done from a vet to a vet, a physio to a vet, a farrier to a vet, or a trainer to a vet. And this is how it looks. You could download a PDF that you could send to someone with summarized results, or you could share the analysis through a temporary web link. You could also invite clients to record from home, which creates another type of sort of touch point between different individuals around the horse. And that means they would record or share at home, do recordings at home that would be sent to your device if you are the person who has the login to Sleip. So you send an invite to the client and they get a limited version of the results. So you can then create this type of network with people that can use these objective measurements to be able to make better decisions together. So what I think is going to be interesting today is to hear more about how you can monitor the change. So that means a professional trainer, a farrier, or a physio could use this asymmetry measure as sort of a temperature measure, I'd say. So it's not measuring lameness, it's measuring asymmetry. And of course, it's a functional output of the locomotor system that we're looking at. So hopefully this could lead to that someone who is closer to the horse in the daily routines of the horse would be able to take decisions to potentially modify training regimes, maybe the intensity or the restitution in the training, the shoeing strategy, or how you'd work with manual therapy to optimize the working conditions for the horse. But of course, again, if the horse has higher levels of asymmetry, that's a horse where you'd rather get your sort of light on and say, this is a horse I need to refer to a health professional. So with Sleip, you'll soon be able to see these types of trends presentations of the data, so making it easier to follow a horse over time, and also sort of zooming in to the specific dates of recordings to see how these sort of motion changes happen over time. And that's actually what I wanted to start with. And then I'm very, very proud to welcome Marc Jerram. And maybe, Marc, you want to introduce yourself. And you can tell us about the literature you've written. And I enjoy very much following your work on Facebook and other social media.
Thank you very much. I'll actually start sharing my screen, if that's okay, and we can go through my presentation. Okay, so first off, I want to say a big thank you to Sleip for inviting me to speak to you all tonight. And I want to say a huge thank you to you all for attending in large numbers. It's absolutely fantastic that there's so many interested in what we're doing here. So in terms of using Sleip and artificial intelligence to monitor the horse, you may think to yourself, well, what sort of effects would farrier have on the upper body? Well, it takes a big sort of effect really on the upper body movements and how we can influence that and how we can monitor that over time. Okay, so I'm going to share with you today some examples of how we can monitor horse health, how we can use corrective farriery to change upper body movements, and as well to work together in a professional collaboration with our paraprofessionals as well. Because as farriers, we are the people that see horse owners the most out of all the professionals. We're there regularly every 5, 6, 7 weeks. So we're more likely to pick up on these subtle changes, and as we all work together as a team to help overcome these conditions. So just a brief sort of outline about myself. I've been a registered farrier in the United Kingdom since 2006. I'm a holder of many postgraduate higher qualifications from the Virtual Company of Farriers, the University of Central Lancashire, and the Royal Veterinary College as well, where we've been performing research historically looking at gait analysis from a video perspective, which does have limitations. And like anything in life, progression takes hold over time as well. And you know, what we're seeing tonight is very much on the forefront of exactly what we need right now. I've had over 60 hoof care articles published worldwide, both in farrier and horse owner publications. I'm an author of my own book, The Hoof Care Companion. I'm a lecturer at a veterinary school local to myself, which has just gone through its first cohort of veterinary students. Provide continual professional development for farriers and vets all over the United Kingdom, and also now I've just become a farrier examiner for examining apprentices at the end of their apprenticeship. So enough about me and something a bit more interesting. We're looking at gait analysis tonight, and of course the collaborative effort of keeping the horse in work and keeping the horse going well. There's a whole range of professionals to take into the well-being of a horse, where it's been the farrier, myself, the vet, nutritionist, the dentist, physio, groom, saddle fitter, rider, just to name a few. There are many more as well, but all part of cogs in the big wheel of keeping that horse going, keeping that horse performing. And I'm not just talking about high-level dressage show jumping horses, even down to your hacking horses or your pleasure horses. We all care about horses deep to our heart, and we want to do the best we can for them. And the more we work as a team, and the more we can share what we know about how the horse is going, the more we can prevent pathology and the more we can enhance horse health as well, which of course is the general theme tonight. So as a farrier, thinking this now from a farrier perspective, can we diagnose lameness? Can we diagnose, we can see a horse here trotting up towards us. This is a very brief video of a horse trotting towards us with a lameness present there. I put it down to right forelimb lameness. And can we diagnose what that is? Well, effectively, we can have an opinion as to effect, like, you know, is this horse sound or lame? Well, it's clearly lame, okay? So that's absolutely fine. The one thing we can't do as farriers is say, well, this horse has got a DDFT tear, just what I can see in front of me. Because I think you open yourself up for, you know, really setting yourself up for litigation and legal complications there. I think if you see a horse trot up, we can then say, well, this horse requires further investigation. Okay, but how do we relay what we see in front of us to our fellow vets, our fellow physios, and to the horse owner as well? Because I can have an opinion on this horse is lame, and then we can also have somebody else on the yard turn up who could be a trainer who wants to give the horse a lesson and earn money from that lesson and say, well, this horse is sound, you know, this horse is ready for work. So how do we define really, how do we get an objectable measure? And this is where gait analysis takes place, because we can have an accurate output as to what we see in front of us. It's repeatable and it's reliable, because that has been evidenced by the studies that have been performed using Sleip. I think there's 2 or 3 now that are in publication, that are peer reviewed, justifying the usage of this and how accurate it is within 2 millimeters of asymmetry of movement. So it's very handy really to help protect us a little bit, especially as farriers, before we dive in and start shooting this horse and leaving ourselves open up to the blame game. And of course, that is the issue with personal interpretation. Okay, because clearly this example here, there are plenty of times when people stare at a horse long enough, they can make the horse lame, or may convince themselves the horse is lame. Equally, there's also some blue sky thinking when the horse is clearly lame and it's overlooked in terms of thinking, well, you know, we've got an event on this weekend, could we just about get through, you know? And this is the things where we can use these technologies to our advantage and to enhance the horse's well-being as well. So historically, these are a couple of examples that I've used in the past. This is at the Royal Vet College, and we can see these are IMU sensor-based applications, and these are still very, very good systems as well. Okay, so this is not a product review. This is just showing you where we got from. Historically, I was using the Equitech gait analysis system using videos in the past, which only captures 2 or 3 strides passing the camera from a 2D perspective, which leads to depth calibration and parallax issues. We have here instead IMU sensors attached on landmarks of the body. Okay, so these are attached to this horse. Quite an expensive setup, I would say, if you were to purchase this for your practice. And you know, it also would require a good level surface as well, which of course is ideal for assessing lamenesses or asymmetries. However, you're always reliant on a dry day, you know, because a lot of times you have to feed the data from these sensors into a laptop. You want to make sure it's not chucking down in rain like it always does in the United Kingdom. As well, these pouches that the sensors are in, they are fairly waterproof and fairly watertight, but they're not completely sealed. So you are worried about those getting a little bit wet as well. And of course, if your horse is brought in from the field and wet, the adhesion of those is not always going to be the best. Okay, so ideally we'd like to have a nice dry horse on a nice dry day. Sometimes you're taking these assessments when you're not expecting to. A horse has been pulled in with an issue unexpectedly, and you may need to do these objective measures on the spot. And also there's probably a little bit of questionability about the repeatable measurements of these as well. We're looking for palpation and placement of these sensors, which can be open to personal interpretation. So although you may get one reading one time, we may get a completely different reading the next time, even though the horse's movement hasn't changed. So that's just something to be a little bit aware of. And also as well, you're reliant on a well-behaved horse. The last thing you really want are these horses to start bronking and galloping around or taking off with all this attached, because you're seeing a lot of money attached to those as well. So there's a few things to bear in mind. And as well, the output of this data, if I was to present it to a client, they would not really be able to interpret those as professionals we can. And that's probably the most important thing, but it's also very important to be able to relay this to the horse owner as well, to make it into language they can understand. And that's where Sleip comes into place. And I've been using this system now from when I first started, I believe. I've been using this now for about 3 years. Use an example here is a photo off the website. These ladies are far more photogenic than I am. And yeah, using a simple tripod you could get for £20 off Amazon, or €20, $20. And an iPhone and a nice level surface, you can do this time and time again, and it's so easy, it's so user friendly, and it's no more complicated than simply recording a video through your smartphone. Obviously it has to be processed through the correct software in order to get the output measures as well. But yeah, this can be done as many times as you like, and as we'll go through further into presentation, the fact it can be done remotely, to me, is still mind-blowing. The fact you can do gait analysis without even having to be there as well. So this is how the gait analysis looks. We've got a screen grab here, and we're seeing a horse here trot away and trot back. Of course, we're recording the gait analysis in trot because that's a 2-beat symmetrical gait. Okay, so the horse is expected to move symmetrically. The reason it's not done in walk because walk's not a symmetrical gait, and there's a lot of variation as well within the walk. Okay, so we're seeing this horse trot away, and we can see a lot of issues there, particularly on the right front. We can see the horse holding the head up as we're going to land on that foot. I know what pathologies are present in there. As well, you can see I've got another gait analysis system attached to the hoof, and now that records hoof flight as well, which we'll discuss a little bit further on. But yeah, a collaborative usage of this is very useful, and the fact we can take this and again, it can be repeatable as well. So what this does effectively is it allows me to come up with an idea. This horse is not moving symmetrically. We've got issues present. And now, do I shoe this horse to overcome this issue, or do I refer this to a vet for further investigation? So I can screen grab this and send this to my fellow veterinary professionals. It's so easy now using WhatsApp or using share buttons, and it's so easy to get an idea of what it gives the vet an idea of exactly what we're up against before we start out, and we've got something we can compare over time as well. So with that trotting up coming towards, you can see that red dot on this horse here. So we're looking at the pole, and we're looking at vertical displacement of the pole in both the terms of an impact and push off aspects of the stride. So the impact of the landing phase of a stride, and then the push off is what I tend to refer to as a breakover phase. Is that horse lifting that pole up during that time, suspending up there, and is there an asymmetry compared to the contralateral limb? Same again, when we're trotting away the hind limb, we can see the two red dots there. Now are reflective of the tuber coxae of the pelvis, which is the palpable area of the pelvis we can feel with our hands. A lot of the time it juts out on the finer breeds. But that acts as a reference point for vertical displacement in terms of impact and push off. And that's basically what we're looking at, really. And we have the levels of asymmetry on the output. So this can vary. So obviously we can go from effectively a 1 to 5 scale, where we can have 0, where it's no asymmetry. Then we have very mild, moderate, and pronounced. So depending on the severity, will affect in terms what we do going forwards. And this is the output. This is the output that comes once the data's been processed. And it can be used to monitor a horse over a period of time. Okay, so you'll see the image on the right there. That is of a shoeing that has been applied. Now, I'm not here tonight to tell you about what shoeing is correct, what shoeing is incorrect. I use a variety of styles dependent on the horse. So yeah, you may think, well, there's other options, particularly for this horse, but this is another tool in the box that worked for this particular one. This is a horse that has previously had navicular surgery and has been quite lame historically. And it's a good couple of years and gone pretty well. But earlier on this year in February, your size showing severe lameness or pronounced asymmetry now, as we can see on the image on the left. So this was taken prior to shoeing, and this horse was out of insurance. So there wasn't really too much money to spend on the further diagnostics. However, I could take this reading, I could send this through to the horse's vet and say, look, this is what I've found. This is what I propose we do. We can use this to monitor over time. Okay, so this is what I did. We took an asymmetry reading. It was quite high. Okay, there wasn't too many strides taken there. I like to see a lot more strides normally. However, because the horse was so lame, I was wanting to just get a general idea of the asymmetry present. So we applied the heel pads there on the right, and then 2 weeks later, because we can use remote analysis, I asked the client to do a fresh trot up on exactly the same area, and we can see a significant improvement already within 2 weeks. So the level of asymmetry is reduced, okay? And then further 2 weeks down the line, we get into a point now where the horse can begin to start work, and the horse has stayed sound ever since. And this is backed up our theory as to why we use the intended shoeing protocol and how this helped to then formulate a rehabilitation plan for the horse owner. Again, on the output, I always like to look at the asymmetry bars and on the severity there. So we can see how much that reduces over time on the top there, the left compared to the right. We can see the degree of asymmetry bars reduce, but also the vertical displacement lines. I love to see those as well, because I think this really does show how clean the horse's movement is. And that also includes behind as well as in front. Although the original issue was on the front feet, we can see by the time we get to the 3rd of March, we can see both the forelimb and the hind limb movement really clean up and stay very consistent. You know, there's very little variation in the stride patterns. Another case study I'd like to share with you as well is a horse with a pelvic asymmetry. And I had a bit of a limited time frame to work with this horse really, because he was going away to move down to Newmarket, down the other end of the country, within a couple of months. And so this horse got called into, he had asymmetry issues on all 4 feet. So basically there's an asymmetry of the front feet, an asymmetry of the hind feet, and also the tubercocci heights of the pelvis as well. We can see a higher tubercocci on the left side compared to the right. So again, this is another horse that had limited budget for further diagnostics. So this was something that was really useful, using the Sleip to really demonstrate what was trying to achieve from a farrier perspective, and how what we can use shoeing and trimming protocols influence upper body movements. So we had a mild push-off asymmetry of the left hind and right front. It's usually diagonal asymmetry we see with these, but it's probably not surprising given the conformation and posture we have in front of us. So the front feet, they presented like this. I like to take a view from behind. And again, this is a farrier protocol that I felt was appropriate for this horse. There are many different ways to achieve what we want to achieve. Horse had previously shod in heart bars. I felt that was overloading the navicular area personally for these particular feet. I wanted something a little bit softer. So instead of using a heart bar shoe, I used a wide webbed shoe with a part leather, part synthetic frog support pad, just to help engage the whole foot and engage the digital cushion of both, and to help just impose a bit more function in there as well. And on the hind feet, so we can see the post-shoeing image on the left. So we're not completely symmetrical there, but we're certainly much more rounded and much more symmetrical than we were from the outset. So we have here the hind shoes with 2 different styles of frog support. So the near side has got a flat frog support pad, and the offside, the right hind, has a graduated 3 degrees frog support, with both having the same level of impression material, the 20 Shore impression material in there, just to help level up the tubercocci heights. Okay, so that was there to help even that up a little bit. And we can see pre-shoeing to post-shoeing. Okay, so this is the static perspective. So although we haven't got perfect symmetry behind, I think obviously we can all agree that's much more like it. It's much more functional for the upper limb to work in a symmetrical pattern. So then I allowed the horse to have 6 weeks in those shoes and come back to repeat a further assessment. And I love it when things like this happen. It makes me look really clever. So he took away all the asymmetry, and by the time we come to shoe, and it's before we shoe him, this assessment was taking place, we can see we justified exactly why we've done what we've done with our style of pads, because the horse has gone from a mild asymmetry of the left hind and right front to being without asymmetry altogether, you know, in a matter of weeks. The horse is moving great, the horse is working great, had great feedback from the riders, and the data that was obtained from the AI analysis has justified that. So we can see how shoeing protocols can affect upper body movements. And again, looking at the vertical displacement lines, we can see if it really start to clean up within a few weeks in terms of the vertical displacement and the asymmetry bars as well. So it's very rewarding to see the horse progress like this, and also to send this on when the horse did move down to Newmarket with I suppose an out of the ordinary style of shoeing. We have a data then to send on to the farrier, you know, who's going to take on this case, to see why we did what we did. And it's, again, it's clear English. It's clear to see in terms of a presentation. It's very easy for people to take this in and to use and going forwards. So now I want to share with you, just to finish off a little bit really, of how I personally use this system now in the everyday. Is that obviously I use this for assessing upper body movements. I get a lot of veterinary referrals all the time. So this is a case here where I'm going to go through. Effectively, we had a quite pronounced left hind asymmetry. This horse is quite lame on the left hind. It's a quite high-end show horse, and obviously it's important we get them correct. All horses, obviously, they're equally as important, but when they're going to a very high level competition, or the reflection to go to a high level competition, you need to be able to assess as much as I can. So I certainly use Sleip a hell of a lot for that. But I also use that in conjunction with a system called Hoofbeat, which uses IMU sensors placed on the hoof to detect hoof flight. And it's quite amazing how much it overlaps the two systems. It has to be used responsibly. Again, a lot of the time as farriers, you're called out as budget vets because, you know, you see so many horses, and then, you know, the horse owners want to use you to assess these issues. However, again, coming back to what we were saying before, we can have an opinion on lameness. We can't diagnose the specific issue. So we can collate all this data together to send on for further analysis. Okay, so this particular horse obviously had a moderate push-off asymmetry from the left hind, and we can see that with the data from the Hoofbeat. We can see a differential in hoof height in terms of left hind and right hind, left hind being the yellow, right hind being the red. And we can see that on the motion map. We can see how that horse has got an asymmetry of landing on that left hind and right hind as well. Okay, so that's important to note as well, because that influences upper body movements and biomechanical efficiency. Of course, all these puzzles and pieces get put together when we come to use a radiograph as well. We can see this horse with a negative plantar angle on that left hind. And then also I like to use it in conjunction with the Metron IQ system for both assessing photographs of the hooves and of the radiographs. And for me as a farrier, being a referral farrier, is so beneficial to have a huge collection of data because it puts into a report. So this particular horse, we have a report from the Sleip analysis, we have a multiple page report from the Hoofbeat analysis, and we'll have a big report from the Metron IQ report as well. So at any time you can have anything up to 50 to 60 pages of data to send, again, easily sent via share to vets, to physiotherapists, to trainers, to other farriers. It's all working together for the horse's well-being. But again, this is how I personally use this as a tool in my box in conjunction with other things. And it's been a real, I hate to say the word game change because everybody says it, but it really has. And it's opened up many more opportunities for me to work with different practices and work on more complicated cases. And also to show the findings and the results. It's very rewarding to see horses improve. And I would certainly say that it's been a big part of that process is the analysis, because it helps you to make an informed decision about what you apply. So I'd like to say a big thank you to you all for listening to my short presentation. And just as a bit of a promo, I have a book out, The Hoof Care Companion. It's available from my website. There's a lot more information about biomechanics in there, but also various other hoof pathologies. There's a lot of interesting stuff in there. I've seen plenty of messed up feet over the years. I hope you can all find it interesting. And yeah, thank you very much.
Thank you so much, Mark, and I can really recommend the book. You were kind enough to send an example a sample to Sleip, and I've read it. It was a lot of fun reading. And again, I would love for you to, you guys who are interested in farriery and orthopedic health, go and have a look at what Mark posts online. There's a lot of very beautiful shoeing for everyone who loves very good sort of crafted work. Thanks, Mark. We are going to move to our next speaker of the night, Dr. Gillian Tabor. Is that the correct
Tabor.
Tabor. It's a little bit French, though you are practicing in the UK.
Yeah, that's right.
And you can tell us about your background, but I know that you're a chartered physiotherapist and you work as an ACPAT veterinary physiotherapist.
Yes, that's right.
We're hanging out in a super interesting congress in South Africa.
Yes,
I
only got home very early this morning, so if I muddle my words, that's because I was flying. But I am glad to be here, though. So let me just. Oh, have I shared my screen? Does that look right?
Yes, working great.
Super. Yeah, it's so great to follow on from Mark. Do you know, I have so many questions about that horse with the asymmetric pelvis and the push-off issues that we'll have to catch up about that afterwards. But yeah, thank you to the team for inviting me to present on the physio perspective of using Sleip. So I've planned really to talk about my use of Sleip, and also how it's been informed really by my colleagues that I've spoken who also use it, so in the UK and around the world. So I hope I sort of represent how physios use it and our role in managing horses, you know, as part of the multidisciplinary team. So just starting off a little bit about me. So I qualified with undergrad in physiotherapy to treat humans to start with, but I always knew that I wanted to treat animals and go on to treat horses. So as soon as I could, I went to the Royal Vet College in London to do my master's in veterinary physiotherapy. And interestingly, I was taught how to assess lameness by Professor Stephen May. So anybody that's actually read any research on biomechanics and lameness, that was May as in May and Wyn Jones, I think, which they wrote the paper in '87. So I feel like I sort of had a good grounding. And then once I had qualified, I started my business. I've been in work with clients now for nearly 25 years. And I've got a particular interest in helping all horses. So it could be Olympic horses, it could be horses that hack. And I spend a lot of my time educating my clients with regards to exercise, as well as doing the obvious sort of more physio, hands-on methods of manual therapy. And I've got some pictures there of electrotherapy. My master's dissertation was actually on the use of ultrasound imaging to measure multifidus muscles. So I've been a little bit geeky about objective measurements. And then since then, I've completed my PhD and I studied objective measurement in equine physio and rehab as well. So yeah, sorry, I'm a little bit geeky about it. The other thing is I'm also a pony club mother, and the pictures of me at the top are actually me jumping my Lusitano, and I have a bit of a preference for an Iberian style horse. But basically just to show that, you know, I'm doing the job that I also teach at Hartbury to do. And yeah, so I love objective measures, and so I'm really pleased to be here able to talk about the newest one on the block. So here's a couple of pictures of clients. As I said, I teach a range of them, racehorses, and on the right there is one of the drum horses that was Hyde Park Barracks that does the Royal parades. And all the horses, you know, they really need the same approach. And just at the bottom of the screen there is a definition of what physiotherapy is. It comes from our Charter Society of Physiotherapy, but you can see we've got sort of quite a wide scope. And, you know, whilst we don't diagnose pathology, which, you know, I'm going to talk about later, we're basically a problem solver. We unravel movement dysfunction, and then we approach what we find within our scope of practice with exercise, manual therapy, education, and advice. So if I break down, you know, a physio's assessment of the horse, you can see it's quite broad. I'm sure I've missed out lots of areas here, but basically we start with our subjective part of the assessment. So it's a sort of clinical history taking, and then we move on to our objective part of it. And I say objective, and I should really put that into air quotes, because from my research that I did in my PhD, we see that a lot of the assessments that physiotherapists use are, unfortunately, you know, they're quite subjective. But obviously more of that later, because how we can move on to using objective measurements is really quite exciting. But our gait assessment, you can see, sort of sits there in the middle, but it's part of a wider assessment that includes, you know, dynamic assessment and also stable-based assessment. So we're going to be looking for ranges of motion, both peripherally in the limbs and then spinally and sort of around the pelvis. So we're really looking at quality of the gait, which is a core component when we're doing our functional analysis. So for physios, it's about building a picture of the horse that can be slightly different to how a vet might be looking at a horse. And I think part of the advantage that I have is that I will see my clients regularly for routine maintenance checkups. And a lot of the vets that I work with might only see that horse, you know, maybe annually for their checkup and vaccinations, or, you know, at that point that the horse is actually lame and it needs that veterinary intervention. And I mentioned lameness there, and as Mark was saying, I think, you know, as a professional sort of allied to the veterinary surgeons, we have to think about lameness as a bit of a different construct. I look at how the horse moves in terms of quality of movement. So that encompasses not just these asymmetries in movement, but also looking about the motor control, the muscle activity and the timing, and also the willingness and the behaviors that might indicate either, you know, a subtle or a more moderate or severe discomfort. But saying that, adding objective gait analysis, even if it is just to one or two of these areas, is now, I feel, a real critical part of my assessment, and it's been massively beneficial to my day-to-day practice. So I just want to go on to talk a little bit about how I use Sleip, because I was doing my gait assessment without a suitable outcome measure, and you know, myself, like many physios, we have to rely on our visual assessment. But what that has meant, and hopefully perhaps not with me because I'm aware of it, I'm professional and ethical about it, but the absence of a tool to really measure things objectively has allowed a proliferation of sort of non-evidence-based therapies out there in our industry. And I think, you know, that's a bit of a concern. I'm sure you've all heard of, you know, the back man that comes on and around and puts the pelvis back in and says, here you go, you know, I fixed your horse. The vet may not have even seen the horse at that point, or the client is just, you know, giving money away and they don't really know what's happened, or, you know, whether the pelvis is back in or not. And I'm sure I don't have to explain to you about, you know, the plausibility of that. But that really sort of has a lot of conflict in our industry, and I think it affects how we work as part of the multidisciplinary team. So the more that we can do, and the more that I can do personally to sort of spread the word about increasing objectivity, I feel that we hopefully will get sort of more recognition, and you know, we can be sort of more confident in our place and in our communication, and really, you know, really cement our part of managing horses sort of in their wider role, either as, you know, Olympic athletes, or perhaps as, you know, horses that hack or companion animals. So what do I find really special about it? Well, it's the quantitative data that comes out of it. There's, you know, a few pictures here of other methods of gaining data from horses as part of my assessment. We've got flexicurve rule looking at thoracic profile. I've got pressure algometer there looking at mechanical nociceptive thresholds. And we know in the field, you know, measuring outcomes is challenging, and I urge any physios that are on here to actually try and explore what they can use out and about. But the reason that a lot aren't used is because of cost, because of convenience, and also because of the time that they take to be used. So this is one of the things that I absolutely adore with Sleip. It is the convenience of it. So we've got some pictures here of some data collection that was happening at Hartpury University. So it takes a day and a half for us to set up these 3D motion capture cameras. We can see a horse that's instrumented with IMUs as well. It's got markers on it, and it can take hours for us to set these all up. Now, obviously, I'm not suggesting that this is part of our day-to-day practice, but this level of objectivity has really sort of set a gold standard. And now, if we can take that out of the research lab and apply that into our practice, I think, you know, we're going to be far better practitioners. One of the issues that we do have with using subjective assessment is that we are all subject to assessment bias. We treated the horse, we want it to be better, so we reassess our horse after our treatment, or, you know, after intervention of a rehab program, and then, you know, we hope that we see it better. That expectation bias is really strong. So using objective measures out and about with our clients on a day-to-day basis is really going to hopefully set us apart by actually showing what we're doing is having benefit. And if it doesn't have benefit, then that's even better as well, because now what we can do is we can streamline our service to use methods that are going to be more effective. Another reason that I'm getting on really quite well with this system is that, as I said, my role in the healthcare management of the horses often involves repeated visits on a regular basis. So on the right here, you can see a screenshot of the number of times that I've seen this particular horse. And I'm fortunate because when I go to see this horse, I get to spend an hour and a half with them, so I can monitor them for any changes. So if I see that there are patterns that are emerging, then I know that at that point I'm going to have to make a decision as to whether this is something that I can manage or whether it is something that I refer back to the vet. You know, we can't do that with one-off treatments, and I do hope that, you know, physios, we're out there for well, we're not there for quick fixes, and we don't want a rapid turnover of clients. We want to monitor these horses throughout their training and throughout their lives. We want to return horses to their previous level of performance if we can do. We want to help the wider team with resolution of injury. And with the real-time monitoring, because we can get those answers quite quickly, we can have before and after treatment sessions as well. So we can really assess to see, you know, what effect we're having in the short term, as well as the longer term over the duration, the time we see it. So it really, really helps with our clinical reasoning. So it helps with making those decisions as to whether the intervention that we're applying is the right one, whether it's appropriate for us to apply that intervention, and whether we should change what we're doing or stick on that path. So that's, you know, we're an evidence-based profession, and so this is supporting our clinical reasoning. One of the things that physios should be doing is we should be developing our personalised treatment plans. And I'm not saying that the use of Sleip is making me do that anymore, but what it is doing is it's giving me feedback so that I can prescribe different exercises, or I can help change what we're doing. So for instance, the horse on the top right there is doing a small circle around to the left. And say we had a mild push-off asymmetry of that right hind, then that is going to work slightly to encourage a little bit more weight bearing through the retraction phase, and then that inside hind leg is coming across underneath the body. And it might be that we've got a forelimb impact asymmetry, and with the vet, you know, the vet's okayed us for carrying on with our activity. What we know with poles is we're going to increase the flexion of the limb joints, we're going to increase the stability muscles working, and so, you know, we can implement those rehab plans with the full knowledge and the tracking of how our horses are changing through that process. So I can't really talk about the use of gait analysis at this level without referring to the Veterinary Surgeons Act, and Mark mentioned it as well. I just want to highlight a concern that I have heard, which is suggesting that physios, if they have access to tools like this, are working outside their scope of practice. And I really want to reassure anybody that might have those concerns that anybody that is professional and is working within their scope of practice will be able to use these tools correctly. So in the UK, I work underneath the Veterinary Surgeons Act, and I am aware that I'm not allowed to diagnose. I work under an exemptions order that was written in 2015 that includes physiotherapy. So I work with referral from my veterinary colleagues, or I am allowed to carry out routine maintenance visits of horses. So long as I know at the point that it isn't appropriate for physio, then I refer back to the vet. It's only the vet that is allowed to make that pathoanatomical diagnosis. So I am looking at the horse from a functional point of view. And so if I have, you know, a picture like this that comes off the Sleip, and I was to say that that horse has got a right hind spavin, you know, tarsometatarsal osteoarthritis, I would be working firstly illegally, and then also outside of my scope of practice from both the Veterinary Surgeons Act and then also my own standards of practice. So if anybody has kit like this, and it's not just Sleip, it could be any of the technologies, and they are providing a diagnosis, then they are working incorrectly. And I don't think, you know, having access to these tools should change that. We should all decide who we want to work with and make sure that we are working correctly. So given that this information I can take from the the Sleip app, I can then have this discussion with the vet and with the owner and with the other members of the multidisciplinary team. So what we're looking to do is by using a standardized outcome measure, we are hoping to improve the continuity of care between us. I haven't yet got any vets in my area that are using it, but I think that would be super exciting, that we could both be assessing horses on different days, but because we're not subject to any issues with reliability, marker placement or IMU placement, then we can have those discussions with clarity between us. And just as a note, you know, I do talk to my owners about what the app tells me, but there are some that I don't mention what I've seen, and we don't discuss it. And that is because that particular owner, I know them well, we have that level of communication that actually means that if I was to, it might actually influence them negatively. So some people don't understand the complexities of gait, and any mild or very mild asymmetry actually might worry them. They might perceive that their horse is fragile, and they may change what they're doing with their horse. So although, you know, I want to have open discussions with some clients, you know, I won't actually show them the output on my phone. But that's a decision I make on a very, very, you know, one-to-one basis. But it's important to know that this sort of interdisciplinary discussion can be based around data and that quantitative output that we get. So how do I use it in my practice? Well, where possible, every horse is sleiped, and I think that should be a new verb. We sleip our horses. But also, I will see my horses in walk. I'll see them do their circles. I will see them on the lunge, and obviously in trot, I can video them. But I want to see the canter. I want to see the transitions. But with this output, I've actually got a reference point that might be feeding into other parts of the assessment. I've also got a record on my phone, so I can review the horse before I arrive at my clients, and I can look at before and after. And although I don't use this feature because all my clients are located in quite a small geographical region, I can see how really useful it is for clients to be able to provide the video of their own horses, and then that be analysed with the same tools, so that, you know, if there was a client that was 3 hours away from their veterinary practice, for instance, you could have regular updates as to how that horse was doing, but on the same level of equivalence with that quantitative data. So I think, you know, that's a huge feature for the welfare of those horses. So in conclusion, I love using Sleip. It's a bit corny, you know, it has revolutionized my practice. As I said, I'm a bit geeky about objective measures, and so, you know, this feeds my bias by hopefully reducing my bias when it comes to assessing the horses. But it doesn't replace anything I do. It's definitely an an increase to what I do, and I am super excited about the use of AI. I think there's going to be so many more areas where it can feed into my assessment, and, you know, I think this is probably, you know, only the start of it. So yeah, it's I think anybody that wants to find out more about it or use it, you know, really see how it can implement and be involved in your practice. But just, you know, to reassure anybody out there, if we're working within our scope of practice as a professional, then that will carry on whether or not we use AI. So thank you very much, and back to you, Elin.
Thank you so much, Gillian. Wonderful to see how you work, and I'm very envious of you and your hands. I'd love to be as good at maniple therapy and all the cool stuff that you do. That was really great, and I think we've seen a few different examples of how you can use this in a practice, then from a farrier and from a physio. So I would now like to turn my attention to the two veterinarians of the panel. You have Stefan, Witte. Tell me if I'm saying that right.
That's right.
That's wonderful. And Stefan, you are a boarded surgeon, also a diplomat of a sports medicine and rehabilitation college. You've worked for many, many years in clinical practice. For me, at least, when I was a PhD student a long time ago, some of your papers were very epic in terms of basic biomechanics of horses in general and how they load their limbs. So you have a very specific sort of research background and a lot of clinical background to this. Tell us, how would you use objective gait analysis with well, any type of systems, because I'm thinking that you've used different types of gait analysis systems. I know that you can sort of maybe focus on the use as documentation, or do you use the data for decision making? Could you tell us a little bit about that?
Yeah, the last, thanks for the invitation, Switzerland, and working a lot on pleasure horses with in a sort of middle-aged population of pleasure horses, a lot of multi-limb lamenesses, and I guess the primary advantage of the objective lameness evaluation for me is my ability to be so much more confident in the localization of the limb and also localization within the limb. It's kind of led to me being more inclined to pursue my own thoughts on a horse with regard to more precise diagnostics with ultrasound and radiographs, rather than sending a horse quicker for a more sort of traditional general screening diagnostic like scintigraphy has just given me the confidence. Whereas prior to that, I might be on a subjective basis, I might be questioning the whole time my ability to see things or not see things. And once you have the objective data in addition, it kind of gives you the confidence to say, okay, I'm seeing the same thing. And what I tend to do is I'll give my subjective opinion to the owner while I'm waiting for the evaluation from previously Equigate and now Sleip, and then I can sort of back it up. And in the majority of cases, hopefully they correlate. And if that's the case, then you feel pretty good about things and you can move forward. And I guess that's the huge advantage that I've had with the found with objective lameness evaluation, is the ability to be confident in what you're doing.
That's nice. You're talking about confidence and precision, and I think that's great. It works the same for me. And I think you're wise to question your visual assessment. I do that all the time myself. And as you say, most of the time, those things would correlate. You'd be, okay with the application. You think that it confirms what you see. But for me, at least, there are a few cases where it doesn't see what I see. Either I would be very firm with my decision and say, no, it's because I see these other motion components that I think are clinically important. And sometimes, and I have to be honest here, I learned that I have a difficulty seeing some specific hind limb lamenesses. So if the horse only has a small push-up asymmetry and no impact component, I have learned through the years using gait analysis that that's actually one of my personal pitfalls. I have a colleague who's super good at seeing that. And so for me, at least, I recognize that type of learning, and that some cases you don't agree. In some of those, you're still confident, or you think about what you've assessed, but you try to define that it's maybe not vertical motion asymmetry that you picked up. It might be something else. And I think the case that Mark showed us with a horse that was running very, very skewed, of course, you can see that there's a lot of other motion components that can be of interest, even though these are very biomechanically solid.
Yeah, I completely agree with you. And initially, I was kind of hesitant, and you have to build confidence with the use of the objective lameness evaluation. And with time and with the number of cases where hopefully if you're doing a reasonable job, it will be you will be in agreement with the objective data, and with time maybe it even teaches you to get better at what you're seeing, and with time and with that confidence, I've come to the conclusion that if I'm not seeing what is being measured, then there's probably an issue with what I'm seeing, and not with what is being measured. And then you have to question things. And at the same time, there is we're talking about asymmetry, and we're not talking about lameness. And the lameness requires interpretation and a lot of feedback or a lot of sort of additional thoughts, different conditions. Seeing a horse on a straight line, on a trot, doing the flexion tests, and all that sort of stuff needs to feed into it. And so there is some potential for you to sort of override the objective opinion if if it needs to be the case, but in the majority of cases, you can it kind of complements one another.
I completely agree. And I think that's a great take home for everybody out there listening, that, you know, the full exam, as you're saying, that includes so many components, so much of the behavioral pattern that the horse has in general. And Gillian was talking about that as well. Like, well, how do you see the behavior in these situations, and how do you read the motion pattern? But I also agree with you that we know that this specific part of the motion pattern is so important in terms of what type of vertical forces the limbs are experiencing. And that is a very common association to what we would judge as being clinical lameness. So there's a strong attention that should be focused on these measurements, but it's not the entire story. The entire story is much more complicated than that when it comes to saying if the horse is lame or not.
Yeah, I guess there's an aspect there also that has been addressed a couple of times and repeatedly in the past with where are the thresholds? Where are the thresholds for Sleip now? I don't know. Maybe you can talk about that and what is a problem for the horse, and the potential for asymmetry to be misused. And we need to be wary of that going forward with the use in various other disciplines or other lines of professional work.
No, but that's a great comment, and to be honest, Stefan, that's why we've gathered you guys here. We're like very wise and people who have been using the application, and I think for us it's really important from Sleip's side to make sure that this is not being misused. And as you say, it is partly about understanding that lameness is a much more complex story. And when it comes to threshold, which is a topic very close to my heart, there are no thresholds for any system out there. What we know, though, is that if you run a horse repeatedly over time, so Kevin Keegan published some papers on this, and he looked at repeatability over like between 5 minutes. If you'd run a horse and you'd run it again 5 minutes later, then you can show that there is some variability that you can expect between these runs if you just look at mean values. And that variability comes close to saying, okay, if you have something smaller than this, then you should probably be very careful to see if this is only variability between different runs that you're making with that horse. Though you might have a horse with a very, very small asymmetry, or to be honest, a horse that's completely symmetrical and that still has an issue. So you will always have, like, you can have a perfectly symmetrical horse with a axial skeleton issue. It won't show up in these asymmetry measurements. At the same time, you might have one of these horses that have a little bit of a jumping behavior. Maybe it's a little bit weak in the hind. We don't really know what it means when they only get a push-up asymmetry of the head. And you often with your eyes see that that's an asymmetry. It doesn't look as if it's hurtful in a way. It doesn't look as if it's painful. And all of these asymmetry patterns, we haven't figured them out in terms of research and clinical research. So as you say, you should be very careful, and you should think of it as sort of a temperature measurement. And that's important with the Sleip colors as well, that in a way it's better to use the horse as its own reference. So what Mark and Gillian are doing here, repeatedly seeing their sort of patients or the horses they're working with, that makes so much more sense to know sort of the pattern over time and to detect changes, and that especially changes in response to increased workload. Those are really important. And we owe it to a lot of these horses out there to be very sensitive and to pick this up.
Mm-hmm.
So that's a great discussion.
Tell me, when you talk about the relative degree of lameness within a horse, I'm used to using millimeter values from the gait, and I know that based on the fact that the Sleip makes the measurement relative to the height of the withers, I think it's and therefore millimeters falls by the wayside. But is there a way to objectify? We're trying to objectify the whole thing, and now we're going back to colored bars that are of various lengths. Is there a way of is there information in the background that we can use to have a more precise value on the degree of asymmetry?
So the degree of asymmetry that you can have a numeric value of that in the application, though that numeric value is related to sort of the proportional size of the horse in the image, because there is no ground truth in terms of size. And most of the users that have the same issue and say, but I'm using the Equigate system or the lameness locator system now called Equinosis, it gives me millimeters. And for sure, we know that those millimeters are sort of fake millimeters, though, as you say, the Equigate system has associated there that sort of accelerometer, a signal that they measure, to a ground truth motion capture system. So they have a good sort of appreciation of what is a millimeter. But I would argue that looking at numerical values have a lot of value, but it isn't about true millimeters. It's about like following these sizes, and a lot of the time a millimeter in a small horse would be something else for a bigger horse. So you anyways always have to adjust these values, whichever system you use, to what you're seeing. So in a Shetland pony, using the motion capture system that I use in the university clinic, I have to convert these values in my head a little bit because it's a very small horse with a small motion.
Right.
And for the other system, like the Equinosis system, then they would relate the size of the asymmetry to the vertical motion of the horse. And then it might be the other way around. A horse that is very big but has a small motion, it will all sort of blow up in terms of asymmetry size. So you have to get acquainted to your own system that you use and not sort of over-interpret very small changes in value. It's more about repeatability, sort of the pattern, and that you look for sort of larger changes, I think, in general.
Mm-hmm.
Thanks, Stefan. That was really helpful. We're going to jump to Karolina, who is also a vet. You're a specialist in horse medicine, working from Sweden. And Karolina, you have been one of our pioneering users. And I think it's very exciting to hear a little bit about your team, because you partly implemented this really as a system that everyone in your clinic used. Of course, I know you've dug in deep into these measurements. Also, you have done the equine gait analysis course that has 6 long modules. So that's a very, very big effort. So you're really sort of specialized into these type of measurements. But how do you use it? And can you give us some input on your clinical use, and maybe a bit, again, looping in the team here, because I know you both share 2 owners, and I think you have a farrier and a physio team around you as well.
Yeah. First of all, thank you very much for inviting me. Since I've had the opportunity to work with objective gait analysis for quite many years now, and I've worked with it even more since we started using Sleip 3.5 years ago. So now I more or less measure all the horses that sound enough to be able to measure. They have to be able to trot enough strides. And before I start talking about our team, I just would like to say that I also do the same as you 2 do. I look at the horse and I tell the owner how I assess it with my eyes, and then I have the results. And most of the time it's the same, but I also experience the same as you do, Elin, that sometimes it's really different results, and then you have to deal with that and figure out why is and the results different. But
how do you feel when that happens? Just I'm curious.
Sometimes it's of course difficult, but I tell the owners that it's not that easy. So I don't think it's hard, but I still want to tell the owner what my own opinion, because I don't want to stop looking at the horse and just rely on data, because I think that's really dangerous. Because as you said before, you have to also see how the horse is moving, if it looks painful, or if it's just using its head and back in a normal way or not, or if it's going on a circle, or if it's going on a straight line on the circle, or well, everything. And so I think you can never stop using your eyes. We have a team at the clinic where I used to work with a physiotherapist and 2 farriers, and most of the time we try to work together if we have the patients together. Most of the time I work with my physio, and then we try to look at the horses on the straight line and on the lounge together in the beginning and in the end of the exam. And sometimes we do things, of course, own examinations and so, but we try to start and stop together to be able to conclude everything and make the best plan for the owner and the horse. And what we also do a lot of the time is to measure the horse before and after treatment of the physio. And we find that very valuable as well. And what's interesting is that we actually can measure significant changes after these treatments. And it's really nice to be able to see that, because we have had the feeling that, of course, it works, but it's also nice to be able to measure it, because as you all know, you sometimes want so much that something, some treatment you do will help. But to actually see that it actually helps is really good. So I think that we have found a very nice way of working together in this way. And sometimes the horse and the owner only sees the physio, and then she measures the horse, and then we look at the results together. And then it's nice to also have the recordings, so we can see if something special happens. And we also monitored the horses in canter, even though we can't see the results because we can't measure that. But it's always interesting just to have that as well, because it also make a nice piece of the puzzle sometimes.
I think that's really good to comment on, Karolina, that the AI will know which gait the horse is in, though it won't give you any biomechanical parameter output. And that's because, you know, all of these technologies are founded on knowledge about the biomechanics of the horse and how we know that relates to forces. And we don't know that yet for the canter. We don't know that very well for the walk either. Those are much more complex gaits. The trot, as Mark commented when he started, is a perfect gait with this diagonal symmetric gait pattern, so that we know really well what happens sort of with forces and motion.
Yeah.
And I know, Karolina, you started very early on as I think one of the first users ever to share these types of recording abilities with your owners. So sending them home with a link or connecting to their phone at home so that they could follow horses during rehabilitation. How did that work out for you? And maybe you could say something about the business model, because I know you joked about like having a lot of streams of recordings sent your way.
Yeah. First of all, we tried to use it on horses that lived a bit far away from the clinic, or horses that maybe they had a tendon injury or so, when we might only see them every 6 or 8 weeks. But then we find it very nice to be able to monitor the horses in between, so we can moderate rehab plan if necessary. And if so that was what we actually started with. And after a while I realized that it was also very useful to get some data or some input from the owner on the behavior of the horse and how things were working at home. So what I usually do is that I send them this link, and then I tell them that they should measure the horse every 2nd week or every 3rd week. And when they have measured the horse, they will send me an email and then a short story about what has happened. And if something special has happened, if sometimes the horse has lost a shoe or something, and that's really important to know when you see the result of the measurement. And then I answer them back. And maybe we have to change something in the rehab plan, or otherwise we can go on. But I think it's a very nice way of monitor horses and get some extra data. What you also should do is try to make them do like the same kind of measurement every time. So usually I tell them to measure the same time of the day, and after some kind of warm up, like walking for 10 minutes or so, and always do it in the same. So perhaps start at the lounge and then do the straight line, and always use the same surface as well to get measurements that you can rely on and that you can compare. Because if you do it on different surfaces, and sometimes in the mornings when the horse just comes out from the stable, and then you should then measure the horse when it has been out on the field, and you should compare those two measurements, and it can be differences that you don't want to have. So
no, that's really true. And I think I'm imagining now sort of a story of a horse that would be in Karolina's clinic. It has a lameness, it's being treated, it goes home. The owner would monitoring and then monitor it using this sort of shared version. You get the results straight back. So that would be a service that you provide to them during their rehabilitation period. It would give them a sort of low-cost type of surveillance service from their vet. And we know that a lot of their owners, they are screaming for that. They are very anxious during that rehabilitation period. Maybe you'd also then ask for a specific farriery. We're imagining now that Mark lives very close to you, or that you might need to consult a colleague. So you'd send your recordings with the case and maybe with some of your x-rays or your imaging to Stefan. So Stefan could help you out remotely. You could share those links. Stefan, you could maybe charge for that because now you have everything in a very good package. So I'm seeing a streamline.
That sounds very good.
Does, doesn't it? And we know already that people in the veterinary business that do consultancy and that are very experienced with interpreting imaging, of course, it's actually a very good way to support your colleagues, but also to make more business. And I'm thinking that this hopefully can be a stream of data that could help us help each other out better. So Mark, if he's the farrier in the field, then he would have done his beautiful corrective shoeing. You could then monitor the horse over time. When Karolina is done, and she might have connected Gillian to the case as well to work on, let's say the horse has top line issues. And then Karolina, she has so many clients, so she can no longer take the stream of data. But then Mark or Gillian can actually continue to work on this client, and you guys could have given this gait monitoring service over time when you see the horse in different periods of its life. And I think hopefully the beautiful thing would be that this horse has at this time generated so much data so that the next time there is an issue, we would know so much more when we get started. So let's say the horse is in a competition, and it's actually in Switzerland now. So perfect. It then goes to Stefan's clinic, and Stefan wants to know if is there a history of this horse. So this history is not only what the owner would tell you, but there is also a history of data. And of course, we cannot always sit and look at thousands of videos, but there are sort of data overviews that we can work with that could get us, onto the problem in a better way. And for me, at least, a lot of the times when I see horses in the clinic and they have small issues, performance issues, and very small gait deviations, I would die to know the history of the gait in this horse and how it has responded to training earlier. So I'm going to leave the word open now to all of you, and maybe you could comment about, have you been sharing this data? So far, Gillian said that there are no vets in her area. They use Sleip. That's a bummer. But if you have shared the data, do you find skepticism from the other equine health professionals like farriers or physios or vets out there?
I can only speak from my own experience that everybody else shared it too have found it extremely useful. And that includes physios, vets. They've used it to sort of back up their own findings, and it's been really beneficial to everybody involved, really. My own personal experience, has been no negative consequences as using that. So yeah, fantastic.
That's great to hear. Gillian, do you want to comment?
Yeah, only that it took a little bit of reassurance to the vets that I was able to share the information to, but once that they were okay and I explained what I was doing with the information, I wasn't stepping on their toes, and yeah, it really did help. And they've actually asked for me to keep sending them updates on certain horses in between their visits, so I think it's added to their information as well.
Any comments from Stefan or Karolina?
I haven't used it too much, and I guess I'd probably be pretty keen on first of all it only being used in a specific context to answer a specific question, which of course is what everyone here would be wanting also, and not to try and it's as so many things is about the client education, not having a barrage of videos being sent on a Sunday to be interpreted on a this horse is asymmetric, but I guess it's all being you're sending out the request for that information to come back, and so you control it to a certain extent yourself, right?
Yeah, or at least it drops into your application, so you don't have to look at your application. You can tell your owners, I'm going to look at this at a particular date. And actually, what I have done is to schedule a call, so they know already when they should record and when they will get a call from me to see that. And that goes also. I have a lot of people that are shopping for horses in different countries, and they would often want to send some kind of pre-purchase exam. So they would send me videos of these horses, and they used to be very crappy videos, very difficult to judge. Now I get much better videos because actually I can invite people to do them through the application, and I can give them better advice on which of these horses they should potentially send for PPE in the area that they're in. And then hopefully you could share that also with the regional veterinarians. So yeah, we're a little bit, I think, and you're pointing out something important, Stefan. I think that you feel that you need to be a little bit confident yourself before maybe sharing or doing these remote types of services. And that's what we see commonly. But I think it will, take on from here. Karolina, you were very ambitious early on to be brave and send this out. But I think you also, didn't you charge per recording at some point because you were also flooded?
We started to do that after a while because it will otherwise you will end up with a lot of recordings. So by charging and put some restrictions around it, then you can control it. But I think this is really the future, and I think that in the future a lot of people will send recordings on regular basis just to have this possibility to monitor over time, and thus a better possibility to early detect changes. So I think that there is a market for doing that as well, but you have to find what you should charge for it and a way when you have time to respond to all this, because otherwise it's a bit difficult. But I think it's really what the owners will have in the future, and I also think it's for the best for the rider, the owner, and the horse, because you will be able to detect things so much earlier.
No,
and
but
I think
agree
that
with you,
maybe you should also test horses before or after big competitions, and maybe more regularly during the season, and maybe you have to just make a plan that suits that kind of owner and horse.
No, and I think it's important. I would love to point out here that this is not going to take away the physical visit at the veterinarian's clinic.
No.
It's not going to take away the physio visit. It's not going to take away the farrier and what you do hands-on with the horse. So this is a complement, as you say. And as you say, Karolina, we have to find the business models for this to be able to provide the best type of service to the owner. And what we see in the veterinary field is that vets are already overloaded with work and are not always very keen to provide newer services. So maybe people who work with horses more regularly, like the physios and the farriers, and like Gillian and Marc in this case, you guys would then add this onto your service. It would give you more information about what you're doing and how you're managing the sort of regular things that you're doing for the horse and for its sort of work environment. And then, of course, the vet can come in at the right time, if you detect something early on that you can send a horse earlier on to a vet, that's great. It doesn't mean that all of these recordings have to be sent to a vet all the time. But you can monitor, you can get an alarm when these levels of asymmetry are elevated, because it might be an indication that this horse needs medical attention. At the same time, you can also see what you can do for the horse, like Marc's super nice skewed pelvis there, and your fingers are like you tickle, you want to fix it, right? Gillian in her way and Marc in his way, and I want to do it in my way, I guess. But adding all these strategies, it's not always the vet who's the most efficient to solve issues like this. It is oftentimes a teamwork that is needed, and especially with these pelvic skewness problems, I don't think as a veterinarian I would fix them half as good as you guys would. But we have to look for pathology and to make sure that we don't have a problem of some kind of specific pathology that we need to address as well. Guys, any more? I'm going to leave the floor open a little bit because I would love to hear more about these business strategies. Gillian, do you charge your patients, like, or your horse owners for this? Or
No, I don't. I think I maybe have to rethink my business model, my strategy. I think if I was to have owners send in their videos to me, I think then that would be a sort of an add-on service, definitely. But I think it supports me and my clinical reasoning more. So I think that confidence is, at the moment, I'm not charging for it. But now you've got me thinking.
I would also think, to be honest, if you're thinking about that, the level of perception, like Stefan was talking about, that you increase your level of perception, and your work is also to work with the gait of the horse. It's not only the veterinarian's work, but for sure what you're doing has to do with how they move. So I think, of course, they're getting more value from your exam when you add this on anyway. So, and Mark, how does it work for you?
I personally do charge. If I'm doing the other assessments, as showed in my presentation, in regards to the other gait analysis or any sort of static assessments as well, okay, I will probably reduce the price a little bit as a package, so it makes it affordable. But standalone, yes, I think you have to, because the client's getting something at the end product there. They're getting something objective, and they got something as a guide as well, and that's worth a lot to them. So personally, yes, I do charge.
Yeah, that's wonderful. And I think that's where we will end up eventually. And I think it is an added value for anyone using it. Of course, I'm very biased here, but I think in general, any type of gait analysis system, I think really adds value, because we know, and we talked about doubting ourselves, but we know that we should be doubting ourselves, because it is a very, very complicated task to look at motion, though you have to look with your eyes always as well as doing these measurements. So I'm just going to pull out some of the questions here. Yeah, we can get some tips here on how to make a business model, because Paul Abril is saying that they charge £15 for a remote service option. That's great. I don't know, Karolina, what did you charge in euros?
50 euros.
50 euros, yeah, okay. That's great. And I know a veterinarian that uses it in the field, and just for add-on to his exams, he would add 150 euros, I think, to his exam, which is quite a lot of money, I think, in general, for the add-on to a physical exam. So that's not even a remote service. So you will see a price spread here, I think. Let's see. Lynn Kjellberg asks, will it be possible to, via Sleip, send questions to a vet connected to Sleip who's specialized in motion analysis? And I think today, no, you have to know your vet and you have to know if your vet is using Sleip. And then, like, Karolina has a special education in motion analysis, and Stefan has done a lot of research in motion analysis. So, you know, that's a good question to ask your vet. Marie is asking if there's a plan to make it available on Android, and we've always said yes, we will, and then we're pushing that because there's so much else we want to develop. So just so you know that, yes, we have the intention, but we haven't even started yet. So far it's going to be iPhone driven for now. And I think Anna comments that it's often about incorrect training and starting with how the horse is trained. And I think she thinks that the trainer is an obvious part of the horse welfare and rehab, and I completely agree. I was just giving lectures on this rehabilitation congress on how to train a horse in hand, which I think is very, very obvious. So I agree with Anna that the trainer has a very important role here. And I think, as we said earlier, that actually professional trainers that monitor their horses, they can also use this application on their end. And we have some very, very high level, some of the very best providers in the world do Sleip their horses regularly and feel that sometimes when they feel this very small thing that they can perceive and they have a question about, is this an issue? And then it can be detected using gait analysis, which has this very high sensitivity. At the same time, every asymmetry is not, a lameness. So it is a difficult task to still sort of a clinical judgment to say what is most important. Let's see, guys, if you see a question you want to answer there. Yeah, Anya says that there's a lot of sources to motion asymmetry. That is true. You can have motion asymmetry from the stomach and intestines. I think that often becomes, they are often, you know, they don't want to work, but they don't always get asymmetrical that much, because a lot of the time that pain comes in sort of irregularly in the gait sort of stride cycles from both diagonals when they're trotting. But no, that's good to think about. There's a lot of different reasons for a horse to move, have an altered motion.
There's a question in there that relates to that horse that we're interested in Mark's presentation. It says,
oh, great, let's dig into that one. The last thing
when a horse is built asymmetrically with different heights of the tubercoxy, how does the app interpret that?
Okay. That's a very, very good question. And the application does measure the tubercoxy. It does measure more than 100 anatomical points on the horse. But what we're actually extracting for this pelvis motion is the midline of the pelvis. So that means it would be, for you guys in medicine, to be in between the tuberous sacralis, or just over the sacrum midline of the horse. And that is the most sort of research point, even though the motion of the tubercoxy, so that the sort of hip points, that is also an interesting motion descriptor for lameness. So if you'd have a skewness of the pelvis that actually goes all the way down to being a limb length difference, then we know from research that that type of horse would have typically less of a push-up from the shorter limb and not going down as low on the longer limb. And that has been shown by Thilo Pfau and his research team. If you just sort of add an orthotic lift under one of the hooves. But then again, a horse can have a skewed pelvis in very many ways. And you can have a sort of static skewness of the pelvis, a roll rotation and a yaw rotation, for example, for you guys who know what that is. And there can also be a dynamic rotation of the pelvis that is very different in different parts of the stride when you're moving on your left or your right limb. So in general, measuring the midline of a horse is still a very important point. But if you have different limb length, then you should watch out. And then there's a known pattern that you should go to. What was interesting, though, with your case, Mark, was that the high side, so if that was a limb length difference or not, I couldn't tell because I didn't see the entire limb. But that was actually a push-off, a decreased push-up from that leg, if I remember correctly, which was sort of a pattern that you see from a right front limb lameness.
Yeah, that's
so you
correct.
Front
Yeah.
asymmetry, and then that could have been a compensatory left hind push-off if you know about these compensatory patterns. But could you comment on this case, Mark, a little bit more?
Yeah, so this was a referral from a physiotherapist rather than the veterinary surgeon themselves. Whatever treatment took place with a physiotherapist, it was complemented with the shoeing as well. Okay, so the horse, because there was an asymmetrical line, I've had some good success personally with leveling up the tubercoxy heights by using different size pads to increase their movement. But it's not only just from the gait analysis assessment, it's also from the rider's feedback as well. I think it all comes in together as one. And also, again, the follow-up session from the physiotherapist highlighted an increased improvement in terms of attention higher up as well. So it's certainly a diagonal asymmetry. We could see that the near side hind tubercoxy was quite raised, and the offside front was quite raised as well. So, you know, quite a high heel. So there was a stilted pattern, and the center of the centrifugal force passing over the withers was off to the one side as well as a consequence as well. So just by engaging those feet rather than shooting the outer perimeter and by compensatory patterns, it resulted in a much more symmetrical gait and a much improved performance of the horse as well. I only got a couple of attempts to shoe the horse before he moved away, but again, it allowed me to justify the protocols of pride and infill the new farrier when the horse moved away, plus the new veterinary surgeon as to why what was done and where we started from and where we got to. It's all good and well sending the reports, but I also like sometimes to get the screen grab of the actual video footage as well, which is what I showed earlier on in the one presentation with one horse. He puts it into perspective then really the findings. You know, it creates a double whammy of assessment, really. So that's what I like to do.
And Mark, just so you know, there's a great share link where you get the video, and you can also now just click and download a video, so don't have to screen record if you don't want to. Or at least it's been released now to make it easier. But great to know also with this case, I think, because if you would then think that the pelvis is skewed because of a limb length difference, then you would actually expect the push-off to be on the other side. So then you can already deduce and say, okay, so at least I can see that it's not likely that this push-up asymmetry would come from a limb length difference, because then the pattern will be different. And then I think also, if you look at literature in human biomechanics, if you look at military service, people that go into military service and they have a limb length discrepancy, the long leg often gets more strain injuries eventually, and then you have a harder impact on the other leg. So, well, we don't know if that's true for horses and what happens over time, because we don't have that research data. But for sure, it is, you know, all of these observations that you can do and then see, does this match, the asymmetry pattern match with sort of just an anatomical asymmetry, then you're fine. Then you try to correct it and you do your thing. Or is it actually that you might even have an indication of this limb being a problem limb already? Then you might have gone to the stage where that longer leg or the shorter leg has more of a subclinical problem that you might want to send to the veterinarian.
Absolutely. I think the origins of that particular injury are from trauma rather than conformational. So just making the best of what the horse is presented in front of us at the time.
Yeah, that's great. So we have many more questions. I will continue to answer some of these online, but I know we said we would end the evening around this time. So I think we can maybe just wrap up. Anyone who wants to comment, any last things from the panel? No, then I want to thank you so much for joining us. It's been a pleasure. I think we could talk for hours here. And I really look forward to see how this will evolve. We're very early on in the stage of like connecting all these dots with data and making it better for the horses, more or less, to share more information about each individual around to all these professionals that can actually help the horse in their particular way. As you say, the trainer, the farrier, the physio, and the vet. So I hope this will lead us to even better collaboration in the future. Thank you so much for joining, and have a very nice evening.